Hello guys, welcome to Medley and Life. In this video, I am going to discuss about the carbolic acid poisoning. We can otherwise it called phenol poisoning, hydroxybenzone poisoning, or phenol poisoning. Yes, phenol is also one of the derivative of phenol. Coming to the objectives, in this video I am going to discuss about the properties, derivatives of phenol, uses, absorption, metabolism and excretion of the components, and mechanism of the action and clinical features and management and autopsy findings, and finally medico-legal importance. Here you can clearly see the carbolic acid crystals. It is needle-like colorless prismatic crystals. It turns pink and liquefy when it is exposed to the air, and it is the sweetest burning taste. The concentrated phenol with impurities is called cresol. The concentrated phenol is dark brown liquid. Here I am showing the carbolic acid in liquid form. Lysol. In routine life, we use the Lysol. It as a mopping floor clean liquid, and Dettol also sometimes we used. And household phenol, that is phenol. Phenol also used in routine our homes. This three also contains the phenol. So it may be the suicidal poisoning or it may be the accidental poisoning to the children. So we alert, and we have to these things away from our children. The Lysol, it contains the 50% of xerosol with sulfonified vegetable oil. In Dettol, it is the chlorinated phenol with tryphenol. And household phenol, that is phenol, it is the 5% phenol in water. And the fatal dose is 50 ml, 25 to 50 ml of household phenol. And the fatal period is 3 to 4 hours. And the derivatives of the phenols are xerosol, thymol, and the naphthol, tannic acid, menthol, coal tar. And the uses of carbolic acid is we can use it as an antiseptic, disinfectant, and manufacture of the plastic. And the absorption, it is absorbed through the skin, gastric mucosa, per rectum, per vagina, and respiratory tract. And the metabolism, the metabolism takes place in the liver. The phenol is converted into hydroquinone and pyrocatechol. These are the metabolites, and it is excreted in the urine. The mechanism of action is both local and systemic action. In central nervous system, it's cause depression and cause metabolic acidosis and renal failure, and it coagulates the protein. It causes methemoglobinemia. The clinical features are, it is local features and systemic features. In local features, which part is exposed to the phenol, it may cause burning pain, numbness, tingling, and it causes corrosion. It produces the white scar and it turns into the brown. And coming to the systemic features, first system is gastrointestinal system. In GIT, the burning pain is followed by the tingling and numbness and anesthesia, and it also causes nausea and vomiting. In respiratory system, the respiration is slow. In central nervous system, it causes headache, giddiness, unconsciousness, convulsion, and coma. And also, it causes oliguria and hepatic failure. The two terms are used in the carbolic acid. One is carboluria. It is the most important MCQ. What is carboluria? Carboluria is when the urine is exposed to the air, it turns into the green color due to oxidation of the metabolites. The metabolites are hydroquinone and pyocat. Another term is ochronosis. What is ochronosis? The pigmentation in the cornea and cartilage. The pigmentation means the deposition of the metabolites, that is hydroquinone and catechol is deposited into the cornea and cartilage. It leads to pigmentation, that is called ochronosis. And coming to the management, whatever the patient comes to you with the poisoning, we have to check three things: ABC, airway, breathing, and circulation. Then we go to wash the exposed part. If it is skin, we have to wash with undiluted polyethylene glycol and maintain the oxygen and ventilation. And we have to give IV fluids for maintain the dehydration. And the stomach wash with sodium and magnesium sulfate solution. And we give lidocaine if it is ventricular arrhythmia is present, and we give benzodiazepines for control the seizures, because carboxylic acid is the one of the CNS depressor. If it is the patient present with methemoglobinemia more than 30%, we have to give methylene blue. If it is more than 70%, we have to do blood transfusion. And coming to autopsy findings, when open in the stomach, it it's smell like phenol. So we have to conclude it is the maybe it is the phenol poisoning. And coming to corrosion of the skin at the angle of the mouth and chin, tongue is white and swollen. The mucosa of the stomach is uh, tough, white or grey. It is corrugated and arranged in the longitudinal folds. The mucosa of the stomach is maybe greyish white, swollen, hardened, and it looks like leathery. When the urine on exposure to the air, it turns into the green. And coming to the medico-legal importance, it may be the accidental poisoning or suicidal poisoning. Very rare it is the homicide poisoning. That's all. Thank you.